I want to acknowledge what Brock is provoking us to think about. In my own words, I'd say rule number one, love our people. And that should guide so much of what we do, love our people. And so specifically for the government, I would say don't leave level 4 until the vaccination rates are over 90% for Māori and Pacific. If you leave level 4 before then, our people are at imminent risk of hospitalizations and death. And you know, that threat, if I bring that home to white people, say, if we have 5% of our population not vaccinated in Auckland, that's something like 70,000 people. And if Delta breaks out among 70,000 people, 20% of them will be unwell. That's 14,000. And of those 14,000, 20% of them will end up in hospital. That's 2,800 people in your hospital system. Your hospital system is broken at that point. Your hospital system cannot cope at that point. White people, wake up, smell the coffee. You need to have us vaccinated, otherwise your hospital system's fucked. So we've got to get really straight about this. I think we've got to be really, really clear about it. Do not put us in harm's way. Love our people. Another conversation we've had is about trust, and I think that's really about tino rangatiratanga. Trust us. Let us have access to the resources. Share the power. We want to be part of the solution, but we must have access to power and resources to get this job done. I'm really interested in the data conversation we're having. I'm really committed to Māori data sovereignty. Give us our data. We've been battling through the whole pandemic to get access to reliable, accurate ethnicity data. That's an entitlement. Māori data sovereignty is a right. So I want to see that. Just to be really explicit, it's not equity if we get vaccinated last. It's that simple. You know, it's not equity if we have the same equal rate of vaccination in the age groups. We are exposed to risk at a much younger age group. So, you know, these guys know what equity is. They just got to harden up and straighten up and get this job done with us. I'm interested in Build Back Better. You know, during the first outbreak, we effectively missed out on something like 60,000 cervical smears, and we'll never get them back. And it's predictable that we will have women who have undetected cervical cancer as a result of those missing smears. It's predictable that we will lose lives because of that cancer that we haven't detected. So building back better means let's go to the international gold standard and have a self-swabbing regime. That's what we should be doing. Fund it, for fuck's sake. You know, save lives, and our community and our, you know, our families are better off. So I just think build back better, build back blacker. Come on, get with it. There's a whole lot of our health system that will not work when we have outbreaks. And so that becomes an opportunity to redesign what we do and how we do and who does it with us. So one of the last things I want to say in terms of loving our people is actually there's so much of this work can be done by our people. It should be that we're employing our people in places like Manurewa and Otara and in the far north and in the East Coast. And the response that we need to have to address the pandemic is effectively 1,000 Māori communities being supported to respond to the pandemic. And we see that when Māori communities are empowered and resourced to respond to the pandemic, we get the best results. Māori, the whānau water providers, you know, just absolutely sensational when the pandemic hit, and they didn't discriminate. They went street by street in Papakura to make sure that everybody had food and water and hygiene packs. We just need to resource more of those responses. We've got to love our people. We've got to trust our people. So that's my main message. Kia ora, peace, out.